Let's look at one final scenario. This one is to demonstrate how the GTR method can be helpful even with very difficult challenges that the mainstream psychology is only beginning to understand. It's a topic that is still a bit taboo, but nonetheless so important to talk about, and it's the phenomenon of skin cutting, where a person would cut their skin to deliberately cause damage to themselves, but without the intention to commit suicide. Cutting is not a completely rare occurrence, which is why it has been recently added to the Registry of Mental Health Disorders, to the Diagnostic and Statistical Manual. And they put it under a broader umbrella of the non-suicidal self-injury diagnosis. Now, skin cutting is a fairly common feature of the borderline personality. However, not all people who engage in skin cutting have also the borderline personality disorder. Psychology is only beginning to understand the non-suicidal self-injury diagnosis, and many question marks are still present. Because of that, non-suicidal self-injury, for now, belongs to a category of disorders that need further study. In other words, psychologists don't know enough as to put it in one of the existing categories, for example, anxiety disorders, eating disorders, or personality disorders. But this is a class on obsessive compulsive issues, and the reason we included skin cutting into this class is because we suspect that at least some cases of cutting involve the two main features of obsessive compulsive issues, that is, obsessions and compulsions. The compulsive part, the skin cutting, is relatively clear to understand. Based on the psychological interviews conducted with the people who engage in skin cutting, it seems to be clear that cutting brings them relief from a very acute and intense emotional distress. But apart from the relief, as you now know, compulsive behaviors are also characterized by the ritualistic nature of the compulsive behavior, where the person has a very good sense of how the ritual has to unfold and what needs to happen in order for it to be complete. In the case of skin cutting, people often report that it's seeing the blood that brings them ultimate relief, and that's when they stop. They would say something like, "And then I saw the red, I felt better and I stopped cutting." In other words, it's not just any behavior they engage in to achieve the relief and the release of emotional distress. It happens very specifically through skin cutting, and it's complete when they see the blood coming out of their wounds. In this respect, it's quite similar to compulsive skin picking or compulsive hair pulling, both of which already officially belong to the category of obsessive compulsive and related disorders. The obsessive part, then, are the intrusive thoughts or urges to cut one's skin. And it's the tension caused by these urges and thoughts that is resolved through the cutting itself. Now, in GTR, we hypothesize, what if there is a deeper layer, a layer beneath the obsessive, intrusive thoughts urging a person to, say, cut their skin? What if there are, at least in some cases, specific traumatic events in a person's past? And what if that extreme distress caused by those traumatic events trigger their OCD traits? Some of these OCD urges, such as skin cutting. And what if there is also an inner critic component, which is so very common in people with complex trauma? And what if some of those obsessive thoughts are very negative, self-loathing thoughts undermining the person's worth, self-esteem, that somehow translate in the brain as thoughts, images, and urges that take a very specific ritual-like form such as skin cutting. If this hypothesis is true, then collapsing the past traumatic events should ease those OCD-like urges, compelling a person to cut their skin. And this is exactly what happened when one of our GTR practitioners worked with a client who has been cutting her skin for decades.
You look at a lot of tribal rituals. You will find it, especially like Africa and I think in the Indonesian islands, you'll find that especially when there's a death or anything like that, that they do the cutting quite often. They scar themselves.
And what is the purpose of that? Do you know?
I think it was originally a way to deal with the pain, to release the pain in their customs. Mm-hmm. I'm not sure, but it makes sense when you think about what causes a person to start cutting. And I know that was the case with my client. She started cutting clear back when she was in school, and nobody realized it for many years that she was doing it. She was hiding it very well.
Yes. And so this client was cutting for decades, really, the one that you worked with.
Yeah, she's in her 40s and she's been cutting since she was in her teens.
And when she came to you, it was at a point that during her more difficult periods, she would cut daily, and she would also carve words into her skin.
Yeah, recently, a few months ago, she tried to commit suicide. And when she was, right before that, when she was really brittle, she started trying to carve actual words into her arm and her chest. And very, very difficult situation.
Yes, and that's where you stepped in. And I actually have a quote that she sent to you saying, "I honestly think you, Pat, and I are doing more to cure my issues than I'm getting in therapy. The therapist is helping me with coping skills, which is great, but you're actually helping me get through and over the problems."
Yeah. It's been so effective, the GTR. It's just been unbelievable for her. Along with the coping skills that she has learned from her therapist, the two in combination have just worked really well for her. And she's doing quite well at the moment.
Okay. And because we've been consulting on this client of yours, here are some of the things that I remember as some of the extremely good results that you were able to guide her towards. The biggest one, obviously, is her handing over her razor blades.
Yes, that was a huge, huge moment for her when she gave those razor blades over to her husband, because she had been hiding those so that nobody could find them, so she would have access. And for her to make that breakthrough was just tremendous.
Yes. And just so everybody understands how huge it is, skin cutting has this compulsive elements. It's very much OCD-like, meaning the person has this urge to cut for whatever reason. And the only way to resolve that tension, that distress, is specifically through the ritual, be it cutting. For somebody else, it might be skin picking or hair pulling, things like that. So the reason why I'm mentioning it is that it's a compulsion. They can't help it. So for you to get her to a place where she voluntarily hands over her razor blades, that's something that, as far as I know, even therapy cannot accomplish.
No, and they say most of the time it's very difficult, even after treatment, for them to let go of that need to cut, because there's something about the sight of the blood that satisfies that need. The satisfaction was actually seeing the blood flow. It was like actively seeing that pain drain out.
And if I'm smiling, I just hope you know it's not because it's funny. It's because this is exactly what we're talking about in this lecture on OCD and similar issues. It's because it's a ritual. A ritual has specific rules. And that person knows how to conduct that ritual and when it's over and when it's complete. And so people who cut often say this very thing, that when I saw the blood, I knew it was complete and I felt better.
Yes. Yes.
Mm-hmm. Yeah. So handing over her razor blades, taking her from being suicidal, cutting every day and covering words into her skin to, okay, something is changing.
Yeah, absolutely. It's changing.
Yes.
Thank goodness.
Yes. And so how is she doing today? I mean, considering how big this is, we wouldn't expect things to change from one day to another. But considering what she had before therapy and other kinds of help, what do you see?
Well, she's been in therapy this whole time. She's seen her therapist at least once or twice a week. I'm very fortunate that the therapist is very open to working with my methods, our methods, the GTR method. She was going to refer her for EMDR in the beginning, the therapist was. And when I found that out, I reached out and said, that's incorporated into our GTR method. I think I can really help you even more so than what just EMDR would do. And so we started working, and it's just been such a success. The transformation has been amazing. And she's learned other coping skills, which have helped her as well from the therapist. But the combination of the two has pretty much eliminated the cutting, and she's a lot calmer. They've adjusted her medications, of course, in this process. But at the moment, she's in a really good place.
Thank you for sharing that, because I find that this is one of those things that are a bit taboo, and yet they're happening. And so we need to talk about them.
Absolutely. Yeah. Yeah. Very hard subject to broach with people because they don't understand. They don't understand how a person could mutilate themselves in that manner.
Finally, there's still a lot of research needed to understand and efficiently treat OCD and related issues. On the bright side, at least some of these issues seem to be triggered and exacerbated by the past traumas from a person's life. And this means that de-traumatizing their system and targeting the root cause of these issues will lead to elimination or significant improvement of their OCD-like symptoms. And this is an absolutely wonderful piece of news. I hope this class gave you a lot of food for thought, and I hope it managed to open your eyes a little bit to what is possible. Until we connect the next time, goodbye.